This segment is sponsored by GBMC Healthcare.
Well, as our nation continues to fight COVID-19, the top weapon of choice has been wearing masks as recommended by the CDC. However, wearing masks during the pandemic has been especially hard on people who have difficulty hearing. So joining us to discuss this topic is Dr. Brian Kaplan, chairman of the Department of Otolaryngology at GBMC. All right, Dr. Kaplan, so when it comes to masking during the pandemic, what have been some of the biggest challenges that your patients have faced this past year?
Well, hey, good morning. Thanks for having me with you this morning. We all know what challenges our patients have with hearing loss, even under the best of times. It's massively underdiagnosed. People struggle, and they often do it in quiet. We know it's a little bit of a silent stigma associated with hearing loss. It's a stigma associated with aging. And even in the United States, 80% of the people who should be wearing a hearing aid aren't wearing a hearing aid.
Wow.
Now we compound that by putting a mask over all of our faces, and now they can't even read lips. And we know that reading lips and reading the facial expressions and the social cues often makes a huge difference in how well patients with hearing loss can do. And we've removed that potential help for them. And patients are really struggling. And unfortunately, they often struggle in quiet and are afraid to speak up, and so they withdraw and they become a little more socially isolated. They don't feel like going out and going to that social gathering or the church function. And we see much higher levels of the isolation and the depression that come on with this age group secondary to the hearing loss. So the mask has really compounded that problem.
Wow, that makes sense. Now, do you have any tips for your patients and then even for the public when it comes to addressing some of these communications barriers?
Absolutely. For the patients, speak up, right? Don't be ashamed. Don't be afraid. Go talk to your hearing healthcare provider, talk to your primary care physician, come talk to any of the otolaryngologists here at GBMC. There's a team of people who are happy to help you. And we know that your hearing is tightly linked to your cognitive ability. It's been shown that dementia, which everyone is afraid of, has several modifiable risk factors, things you can do to help prevent that. And a landmark paper over the past few years looked at all the things you can do to help prevent dementia. And the number one thing was treating hearing loss. It trumped all the other health conditions that they looked at. For the family members and friends of those with hearing loss, it's important to remember that these people are going to be struggling. We all struggle as we get older with some background noise when you put that in a loud restaurant. And now you're putting the mask into that equation as well. So try to talk a little bit slower. Try to look at the patient that you're talking to. Remove any of the distracting background noise. Enunciate a little bit better. It'll make a big difference in how well that person can hear you.
Wow, all right. Such awesome advice, Dr. Kaplan. We certainly appreciate you joining us today. Thank you.
Thanks for having me.